Good morning and Assalamu alaikum. They will be doing the audiometric tests, okay? So that we're gonna study the two of them, the audiometry and tympanometry, okay? Then there's the pure tone audiometry. It is basically on different frequencies and different decibels, okay? There's from 1 to 5 to 8,000, okay? And for bone conduction, these are for air conduction. For bone conduction, there's from 250 to 4,000. Okay, the chart is called the audiogram. Okay, it looks something like this, but I'll show you in detail. There's the AB gap, and I'll show you what AB gap is. Okay, and then there's the tympanometry. In tympanometry, we basically see the reflection of the tympanic membrane. Okay, this is the pinna, as I told you before. This is the external auditory canal, and this is the tympanic membrane. Okay, we'll use the tympanogram. Okay, and one is for making noise, the making sound. Okay, the second is for conducting it, and third is the microphone. Okay, and basically the energy which is created, it is transferred and transferred to the ossicles, and some of it is reflected back. And the tympanogram basically, the impedance audiometer basically interprets the sound coming back. Okay, and we'll study it in detail. This is a tympanogram, and we'll study the different types. Okay, in shortly. First of all, let's see audiogram. Okay, this is an audiogram. I'll just maximize it. Okay, these are the different frequencies and hertz, 125 to 8,000, and this is the hearing loss in decibels. First of all, we should know the basic signs. X is for left, okay? The X is for left here, and the O is for the right here. C is for the bone conduction of the right ear, and the C inverted is for the bone conduction of the left ear. Okay, so this is like C. Okay, so it is for bone conduction of the right ear, and this is the circle for the right ear. Okay, so this audiogram is for the right ear. Okay, we established this. Then always remember, bone conduction will be above 20 decibels. The machine takes 20 decibel as a standard, so we'll always say bone conduction will be above 20 decibels. Okay, this is the air conduction. Air conduction will always be below 20 decibels. The lower it is, meaning there is the problem with the air conduction and the person is hearing on the very loud decibels. Okay, if there is bone conduction at this level, the graph is at this level, meaning there is problem with the, sorry, the air conduction is at this level, meaning there is the problem with the air conduction of the person, and the person is hearing on 90 decibel. If there is, the graph is made here, it means the person is hearing normally at 70 decibel, which is not normal. It should be here above, okay, not very below the 20 decibel. I hope you got my point. Okay, let's look at this picture. basically we'll first see the signs, this and this. So I have told you before, this is the sign for the bone conduction of the right ear. O is the sign for right ear, the air conduction of the right ear. So this is the audiogram of the right ear, and as you can see, as compared to this one, there is like a difference between the both of them. You see there is a distance between the both. Okay, this distance, if this distance is more than 15 decibel, it means there is a problem with the conductive hearing loss. Okay, if there is no distance between the two, so the distance is less than 15 decibel, so it means there is sensory neural hearing loss, not conductive. It was more than 15 decibel, then it was conductive hearing loss. But now in this case scenario, this is the sensory neural hearing loss, and the distance between two is less than 15 decibels. Okay, let's move forward. This is the audiogram for the left ear, because there's X. Okay, and as you can see, there is a dip. As I have told you before, the conductions should be above 20 decibel. Okay, the bone conductions should be above 20 decibels, and the air conduction should be below 20 decibels. As you can see, there is a dip, and this dip is called Cahard's notch. Cahard's notch. And if there is a Cahard's notch at 4000 frequency, it means it is noise induced hearing loss, because noise induced hearing loss always starts at 4000 hertz. Okay, so if you want to write it on in exam, you'll write there is a Cahard's notch at 4000 hertz, and the bone conduction, sorry, the air conduction, the bone conduction is below 20 dB. So there is a problem, and the problem is the noise induced hearing loss. Okay, let's see, this is a tympanogram. We'll do it shortly. Okay, this is for the right ear. Okay, the signs are like this, and it is a conductive hearing loss between, because there is a distance between the two more than 15 decibels. Okay, the reasons for congenital, there are different reasons for conductive hearing loss. Congenitals mean by birth. It can be a mutual atresia. This is the pinna, and this is the meatus. The atresia can be the shortening or the small aperture of the meatus. The fixation of the stapes foot plate, meaning it's not working, is fixed, it's not moving. Or the fixation of the malleus head, it's not moving either. Ossicular discontinuity due to a trauma, discontinuance in the ossicles, and the congenital cholesteatoma. Okay, there's a cholesteatoma, means skin in the wrong place, meaning the the skin of the external ear can come to the middle ear. Okay, so it will be called the cholesteatoma. In acquired causes, there can be external ear problems, meaning there is any obstruction in the conduction with wax or foreign body, a furuncle, or there's some kind of swelling, okay, in tumor or atresia of the canal. Okay, in the middle ear, it can be the perforation of the tympanic membrane, meaning it's not conducting. Okay, it can be traumatic or infective. Infective as in ASOM, CSOM. In trauma, meaning there's some accident, and or there's some fluid accumulated in the middle ear. Okay, in CSOM, acute otitis media. Okay, serious otitis media, OEM, OME, sorry, OME, otitis media with effusion, okay, or ASOM, acute separative otitis media, okay, or there's some mass in the middle ear, benign or malignant. As you can see, this is for the right ear, okay, O is always for the right ear, and the difference between the two, distance between the two is less than 15 dB. So it is sensory neural hearing loss with no AB gap. Okay. Okay. In this one, it is again a dip at 4000 with a Cahard notch. So it is the noise induced hearing loss. Okay. So these are the some ranges: 20 to 25 normal, 26 to 40 mild, 41 to 55 moderate, 56 to 70 moderately severe, 71 to 90 severe, greater than 90 profound. Okay, so it should always lie here. Okay, this is the normal range, this is the normal range, this is not. This is for the mixed hearing loss. Okay, it is the combination of sensorineural with conductive component. It can be seen in older adults with presbycusis, meaning old age hearing loss. It is conductive as well as sensory neural. Okay. Okay, this is for the Meniere's disease. As you can see, there is this is for the right ear conductive hearing loss. Sorry, it is for the right ear conduction. Okay, this is the bone conduction, and this is the sensory neural hearing loss, because in Meniere's disease there is always a sensory neural hearing loss. This is a rising curve A, meaning the early disease. This is the for the second, meaning it is flat. Okay, these are the untreated frequencies. But when it is B flat, meaning there is no conductance, so there is Meniere's disease. The differentials can be presbycusis, old age hearing loss, acoustic neuroma, a familial progressive sound, noise hearing loss, ototoxicity by some medicine, or sudden hearing loss due to some trauma, etc. This is again a sensory neural hearing loss. Okay, it can be also due to the labyrinthitis, okay, or some trauma or ototoxicity. This is again sensory neural. This is noise induced Cahard notch, but this is a Cahard notch, but not noise induced. It can be due to otosclerosis. Okay, this is the conductive hearing loss. It is due to the hardening of the oval and round windows. Okay, okay. This is again conductive hearing loss. This is sensory neural. It is due to the aminoglycoside, the ototoxicity. Okay. Um, see, what is this? It is again otosclerosis, and it can be caused by surgical management, and it is the conductive hearing loss. These are some examples, you can study them for yourself. Okay, I have taught you this before. Let's do a tympanogram right now. Let me check. Okay, we'll do a tympanogram. Okay, here is it. Let me maximize it. Okay, so this is the tympanogram. Type A is called the normal tympanogram, meaning that a normal tympanogram is from 100 to minus 100. Okay, the pressure should be from plus 100 to minus 100, and the values should be from 0.3 to 1.5 ml. Okay, compliance. Compliance means how much sound is passing through the tympanic membrane, how much sound the tympanic membrane is allowing into the middle ear, and how much sound is touching the ossicles. Okay, and if there's more compliance, meaning more sound is going from the tympanic membrane to the ossicles and touching the cochlea in the oval window. Okay, for example, in A, this is the normal one, meaning it is the normal compliance of 6. 6 is the normal compliance at 0 pressures. These are the pressures: 0 plus 100 minus 200 plus 100 plus 200. These are the pressures. Okay, at 0 pressure the compliance should be 6 at level 6. Okay, it is the normal curve, and when this, as you can see, AS, this is an abnormal curve. S means stiffness. S means stiffness. Okay, and the compliance is lower than normal. It is seen in the fixation of the ossicles, meaning there is some problem in otosclerosis or the fixation of the malleus. Okay, the ossicles are not moving. The ossicles are not moving. In type AD, discontinuity, meaning there is some problem with the tympanic membrane or the ossicles. The ossicles 1, 2, and 3 are not matched. There's some problem. They are detached due to trauma or something. Okay, or the tympanic membrane, usually like this, is too lax. It is like not at its normal form. It is, the diaphragm is not tense. Okay, and it will allow more sounds to pass. Okay, so it is seen in ossicular discontinuity or thin or lax tympanic membrane. So the compliance too much. This too much sound is passing forward. If it tense, it will allow less sound as compared to relax. In type B, there is a flat curve like this because there's no pressure changes. Okay, there should be some fluid. The sound waves are not returning back to the microphone. Okay, when they, when the sound waves are touching the tympanic membrane, they are reflected. Okay, in which cases they will not reflect? In cases when there is fluid in the middle ear, or there is a perforation of the tympanic membrane, so the sounds are not returning back simply. Okay, so it will show a uh, type B curve like this. Okay, this one, dotted one. Okay, this is a type B curve. And type C curve, this is a bit tricky. As you can see, the maximum point is being made at minus 200. Okay, you saw that. Okay, it is due when there is some problem with the eustachian tube. Okay, as you can see, I am now making it. This is the pinna, the external auditory canal, the tympanic membrane, the ossicles, and the cochlea, and the semicircular canals. In the middle ear, there is a eustachian tube regulating the pressure inside and outside. If outside there is, for example, 100 pressure, okay, the tympanic membrane will regulate it 100. Okay, so there is equal pressure outside and inside. If there is closure of the eustachian tube, for example, the inner pressure is 50 or the inner pressure is minus 100, so due to it, the inner pressure, the tympanic membrane will bulge inward because it will create a vacuum. So in order to read it on a tympanogram, we'll start decreasing the pressure as well. When we will decrease pressure, the tympanic membrane will look normal like this. Okay, before it was vacuum and bulging inwards, and then we started decreasing the pressure outside the ear canal. Okay, we're decreasing the pressure from the machine outside the ear canal to minus 200 as well. Okay, so the tympanic membrane will start looking normal like this, and the graph will form at the minus 200. Okay, I hope you got my point. So it is a tympanogram, and we will study this different tympanogram in that file as well. Okay, let's see. Okay, so we'll see some diseases. It can be due to type C can be due to eustachian tube. Okay, B can be due to otitis media with diffusion or ASOM. AS can be due to otosclerosis. Okay, AD can be due to ossicular discontinuity. Okay, this is again the same thing. Let's go downwards. We were here, yes. Okay, let's see whether you can see it or no. Okay, let's practice. This is type B because it is flat. This can be type AS. Okay, or this is type B again. This is type C because it lies in negative side. This is type B again, flat. This is tympanogram with high peak pressure. Okay. Okay, this is type B because it is flat. Dome shape, no change in compliance, middle ear fluid or thick tympanic membrane, or there is perforation of the tympanic membrane. Okay, now let's see this. This one is normal but stiff. It is a small one. If it was normal, then it should be at 6. Okay, see 600. It is not, but it is at 200. So it is the AS type, and it can be seen otosclerosis or Meniere's head fixation. Okay, this is audiogram. No, yes, this one. See, this is a normal, this is a stiff, and this is a D, okay, discontinuity. This is the type A normal, it should be from 3 to 1.5, not 2, okay. Okay, this is type T, discontinuity, or thin or lax tympanic membrane. This is type C again, due to the negative, okay. It can be seen in retracted tympanic membrane due to the eustachian tube problem, eustachian tube obstruction, or early stage of otitis media with effusion, because the fusion will also block the eustachian tube. Okay, that was all. Thank you for watching. If you have any questions, you can ask in the comments.